52-year-old man lies in bed, eyes open, staring at the ceiling. He's been awake for days, not by choice. He desperately wants to sleep, but his brain has forgotten how. At first, it was just trouble falling asleep. Mild insomnia, annoying but manageable. Then it got worse. Nights without sleep turned into weeks, then months. Now he doesn't sleep at all, not even for seconds. Eventually, the patient will succumb to total insomnia, agrepnia excitata, complete, absolute sleeplessness. His heart races constantly. He sweats through his clothes. His blood pressure spikes. He's losing weight rapidly. He can't concentrate. He sees things that aren't there. Hallucinations and panic attacks become noticeable. His family watches helplessly as he deteriorates. They know what's happening. They've seen it before. His father died the same way. And his grandmother. And his great-uncle. It runs in the family. He has fatal familial insomnia, FFI, a genetic prion disease that destroys the part of the brain responsible for sleep. It results in death within a few months to a few years, and there is no known disease-modifying treatment. The life expectancy for a person diagnosed with FFI is poor, especially after symptoms start, where the life expectancy ranges from a few months to a couple of years. The mean duration is 13 months. There's no cure, no treatment that stops the progression. Just a slow, inevitable march toward death, awake every minute of it, watching your mind and body fall apart. Sleep is not optional. It's not a luxury. It's as necessary as food, water, oxygen. When you can't sleep, when your brain physically loses the ability to sleep, you die. This is fatal familial insomnia. FFI is an extremely rare disorder. The exact incidence and prevalence of the disorder is unknown. Fewer than 200 cases have ever been documented worldwide, whereas the recognized patients with FFI are numerous and belong to greater than 50 families worldwide. And if you have the genetic mutation, there's a 50% chance you'll pass it to your children. A death sentence written in DNA. Fatal familial insomnia, FFI, is a rare genetic condition that affects your brain and central nervous system. It causes you to have trouble sleeping, insomnia, memory loss, dementia, and muscle twitching. FFI is degenerative, which means symptoms get more severe over time. FFI is classified as a prion disease. Prion are misfolded proteins that cause other proteins to misfold, creating a chain reaction that destroys brain tissue. Other prion diseases include Creutzfeldt-Jakob disease, CJD, and mad cow disease. A mutation or change of the PRNP gene causes fatal familial insomnia, FFI. The PRNP gene is responsible for making the prion protein PRPC. Prion protein PRPC exists in your brain, specifically in the thalamus, which helps regulate body functions like sleep. The thalamus is a small but crucial part of your brain. It's the relay center processing sensory information, regulating consciousness, and most importantly for FFI victims, controlling the sleep-wake cycle. In FFI, prion protein deposits were heavily concentrated in the thalamus, specifically destroying the regions that govern sleep. As these brain cells die, the ability to sleep simply stops. Dominant genetic disorders occur when only a single copy of a mutated gene is necessary to cause the disease. The mutated gene can be inherited from either parent or can be the result of a changed gene in the affected individual. The risk of passing the mutated gene from an affected parent to a child is 50% for each pregnancy. The risk is the same for males and females. Think about what this means if you carry the mutation. Flip a coin for each child. Heads, they're fine. Tails, they'll die of FFI. You might not know you carry it until symptoms appear, usually between ages 20 and 60. By the time you find out, you might have already had children. You can test for the mutation, but then you live knowing your fate. Some families affected by FFI have tracked the disease through generations. The pedigree included 288 members of 6 generations, on which records had been kept since the early 19th century. Of the 29 members who may have been affected by the disease, 14 were recorded as possibly affected on the basis of non-medical records, 8 were considered probably affected on the basis of medical records, and 7 were proved to be affected on the basis of histopathological examination. Imagine knowing your family tree includes dozens of relatives who died unable to sleep, their brains eaten away by misfolded proteins. Imagine wondering if you're next. Even more terrifying, some individuals have developed fatal insomnia, FI, without a variation in the PRNP gene. These individuals are said to have sporadic fatal insomnia, SFI, and although this is a non-genetic form of FFI, the underlying trigger for its development is unknown. Thus, SFI occurs randomly by chance with a much rarer occurrence than FFI. Sporadic means it can happen to anyone. No family history, no genetic mutation, just random catastrophic bad luck. Your prion proteins spontaneously misfold and you develop fatal insomnia. The sporadic form of FFI, known as sporadic fatal insomnia, SFI, is extremely rare and has only been described in the medical literature in a few dozen people. But a few dozen means it's possible. Means you could be healthy today and 6 months from now, lose the ability to sleep forever. The disease begins with a subacute onset of insomnia, difficulties falling asleep, wake early and inability to take his usual naps, which progressively worsens over several months. During this stage, patients may experience psychiatric symptoms such as phobias, paranoia, and panic attacks. Lucid dreaming may also be reported by patients at this time. At first, it seems like ordinary insomnia. You have trouble falling asleep. You wake up early. Naps don't help. You're tired but can't sleep. Then come the psychiatric symptoms, characterized by worsening insomnia, resulting in panic attacks, paranoia, and phobias. This stage lasts for about 4 months. You start feeling anxious for no reason. Phobias develop irrational fears that don't make sense. Panic attacks strike without warning. You feel like you're losing your mind, because you are. Your thalamus is dying. The same region that controls sleep also regulates emotion and stress response. As it deteriorates, your psychological state collapses. Hallucinations and panic attacks become noticeable, continuing for about 5 months. The hallucinations start. Visual distortions, sounds that aren't there, sometimes full sensory hallucinations that seem completely real. Daytime drowsiness, head/eyelid drooping, apathy, but social behavior intact. Here's the cruelty: you're exhausted. Your body screams for sleep. You feel drowsy. Your head nods. Your eyelids drop. But you never actually sleep. Not for a second. It's like being perpetually on the edge of sleep but unable to cross into it. That frustrating feeling when you almost drift off but something jerks you awake. That becomes your permanent state. Complete loss of sleep. Fatal insomnia is a prion disease with symptoms including insomnia, mental deterioration, and loss of coordination. Typical early symptoms: severe insomnia that continues to worsen, accompanied by ataxia, inability to coordinate movements, and mental confusion. Dementia and weight loss increase over time. By this stage, you don't sleep at all. Not even microsleeps, those brief seconds of unconsciousness that usually happen when severely sleep deprived. Your brain has completely lost the ability to enter sleep states. May also include excessive sweating, unsteady gait, jerky eye movements, double vision, dysarthria, high blood pressure, hyperventilation, excessive tearing, hallucinations, panic. Your autonomic nervous system, the automatic functions you don't control, goes haywire. Autonomic, e.g., tachycardia, hyperhidrosis, hypertension. Symptoms intensify. Your heart races constantly. You sweat profusely. Blood pressure spikes dangerously. Your body temperature fluctuates wildly. You lose massive amounts of weight because your metabolism is in overdrive. You can't walk straight. Your movements become jerky, uncoordinated. Your eyes move erratically. Your speech slurs. And through it all, you're awake, conscious, aware of every horrifying moment of your decline. The disease course of FFI has been reported to last anywhere from as short as 7 months to up to 3 years. The average life expectancy is 18 months after diagnosis. In the final stage, dementia sets in. Cognitive, e.g., short-term memory and attentional deficits, worsen dramatically. Memory disappears. You can't recognize family. You can't speak coherently. Your personality dissolves. But you're still awake, still conscious on some level. trapped in a failing body with a disintegrating mind, unable to escape into sleep. Finally, mercifully, death comes. The cause of death for people diagnosed with fatal familial insomnia is damage to the brain and nervous system. This damage, caused by prion proteins accumulating in the thalamus, creates symptoms of insomnia and mental deterioration. The thalamus and other brain regions are destroyed. Critical functions fail. The body simply gives out. The disease starts between 35 and 60 years of age, is inherited as an autosomic dominant trait, and leads to death within 7 to 32 months. From first symptom to death, usually 7 to 32 months. More than 2 years of progressive, untreatable deterioration, awake through every moment of it. Imagine knowing FFI runs in your family. You watched your parent die, maybe a sibling, maybe multiple relatives across generations. You know you have a 50% chance of carrying the mutation. You can get tested. Genetic testing can definitively tell you if you have the PRNP mutation. But do you want to know? If you test positive, you're living with a death sentence. You know that sometime between now and your 60s, you'll likely develop symptoms. There's no prevention, no cure, just waiting for insomnia to begin, knowing what comes next. If you test negative, you're free. But many people in FFI families choose not to get tested. They prefer uncertainty to the certainty of doom. If you have the mutation, do you have children? Each child has a 50% chance of inheriting it. Do you risk passing this nightmare to the next generation? Some families with FFI have chosen not to reproduce, letting the mutation die out. Others use preimplantation genetic diagnosis, IVF with genetic screening to ensure only embryos without the mutation are implanted. But these are expensive, invasive options not available to everyone. And some people don't know they carry the mutation until after they've had children. We previously described 2 members of a family affected by an apparently genetically determined fatal disease characterized clinically by progressive insomnia, dysautonomia, and motor signs, and characterized pathologically by severe atrophy of the anterior ventral and mediodorsal thalamic nuclei. The disease was first formally described in 1986 by Italian researchers studying a family that had been affected for generations. This family became central to understanding FFI. The entire kindred has always lived in the northern part of Italy, with the exception of subject 4-37, who emigrated to France with her immediate family. For this family, FFI isn't just a medical condition. It's family history, family tragedy, family curse. Generation after generation watching relatives die the same way, knowing some of them will be next. What's it like to watch a loved one die of FFI? First, they can't sleep. They're tired, irritable, but it seems like ordinary insomnia. You tell them to try melatonin, meditation, sleeping pills. Nothing works. Then the personality changes. They become paranoid, anxious, fearful. You think maybe it's a psychiatric problem. Therapy, medication, still nothing works. Then the hallucinations, the weight loss, the physical deterioration. Finally, the diagnosis, fatal familial insomnia. And you know, there's nothing you can do, nothing anyone can do. You watch them decline. Watch them lose the ability to walk, to speak, to recognize you. Watch them suffer through months of progressive neurological destruction. Conscious through all of it, unable to find relief in sleep. And if you're their child, you know you might be next. Sleep plays an important role in keeping you healthy. Sleeping improves your mental and physical health. When you're asleep, your brain works with your body to support itself so you feel awake and energized in the morning. If you don't get enough sleep, your brain loses the ability to recharge, and it affects your ability to think and function normally. Sleep isn't rest, it's active maintenance. During sleep, your brain consolidates memories, clears out metabolic waste products, repairs cellular damage, regulates hormones, strengthens immune function. Without sleep, all these processes fail. Your brain essentially begins to poison itself with its own metabolic waste. Neurons die. Connections break down. Cognitive function collapses. People diagnosed with fatal familial insomnia are unable to sleep, which disrupts how their brain functions. This creates negative side effects that challenge their overall well-being, causing life-threatening symptoms. FFI proves that sleep is not optional. The longest anyone has lived without sleep in controlled studies is about 11 days, with severe psychological and physical consequences. FFI patients go months without sleep before dying, not from sleep deprivation alone, but from the same brain damage that causes the insomnia. Since FFI is fatal, a palliative care discussion should be integrated at the time of diagnosis. Ongoing goals of care discussions can be beneficial in optimizing symptomatic relief and ensuring comfort care measures. Let's be clear, there is no treatment. Treatment involves palliative care. There is conflicting evidence over the use of sleeping pills, including barbiturates, as a treatment for the disease. Sleeping pills don't work. Sedatives don't induce actual sleep. They create a drugged state that isn't restorative and doesn't stop the progression. Additionally, medications that worsen memory and exacerbate confusion, e.g., anticholinergics and benzodiazepines, should be avoided. Supportive care measures include nutritional support, adequate hydration with fluids, and pain management. Physical and occupational therapy may be helpful to maintain or prolong functional status and to manage motor symptoms. Treatment is purely symptomatic and palliative. Manage the anxiety, the hallucinations, the pain. Try to maintain quality of life for as long as possible. Then hospice care. Scientists are studying FFI and other prion diseases, searching for treatments. 3 main types of immunotherapy are under investigation: antibody vaccines, dendritic cell vaccines, and adoptive transfer of prion protein-specific CD4 plus T lymphocytes. Antibody vaccines specifically target epitopes found only on the misfolded form of prion protein, PRPSC. The challenge with prion diseases: by the time symptoms appear, massive brain damage has already occurred. Prion accumulate for years, decades, even before symptoms start. Generally, prion disorders are characterized by long incubation periods and short clinical duration, which means the abnormal prion may accumulate for many years without causing symptoms, long incubation period, but once symptoms begin, the disorder rapidly worsens. This means any treatment needs to either prevent prion misfolding before symptoms, requiring identifying carriers early. Stop prion spread after symptoms begin, extremely difficult. Repair brain damage, currently impossible. Research continues, but for now, FFI remains 100% fatal. FFI raises profound ethical questions. Should people in affected families be tested? Genetic testing can identify carriers decades before symptoms. But is it better to know or not know? Should carriers have children? With 50% transmission risk, is reproduction ethical? What about assisted death? As FFI patients deteriorate, unable to sleep, losing cognitive function, experiencing constant distress, should they have the option to end their lives before the worst stages? These aren't abstract questions for FFI families. They're real decisions with life and death consequences. Fatal familial insomnia is a disease from nightmares, literally. It takes away the one thing we all take for granted: the ability to sleep, the ability to escape consciousness, to rest, to let our brains and bodies repair themselves. Symptoms of fatal familial insomnia, FFI, begin between the ages of 20 and 70. The average onset of symptoms is age 40. You could be fine today and symptomatic next year. The disease is currently incurable and has a mean course of 18 months, ultimately leading to death. 18 months from first symptom to death. 18 months of progressive deterioration. 18 months awake. FFI is extraordinarily rare. You almost certainly don't have it. You almost certainly never will. But FFI teaches us something important. Sleep is not optional. It's as necessary as breathing. When your brain loses the ability to sleep, you die. Not immediately, but inevitably. Every time you struggle with insomnia, remember, your brain still knows how to sleep. For FFI patients, that ability is gone. Forever. Right now, there are families living with FFI. Parents who've watched relatives die, wondering if they carry the mutation. Children who know there's a 50% chance they inherited a death sentence. Some have been tested and know their fate. Others live in uncertainty, each birthday bringing them closer to the typical age of onset. each night of insomnia triggering fears that this is the beginning. Patients and families should be thoroughly educated about the fatal course of FFI. They should also be informed that there are currently limited treatment options, but studies are ongoing. Genetic counseling should be offered to family members as well. For these families, FFI isn't a medical curiosity, it's their reality, and they face it with courage that most of us can't imagine. Tonight, when you go to bed, you'll probably fall asleep. Maybe quickly, maybe after a while. You might wake up during the night. You might not get enough sleep, but you will sleep. Your brain will do what it's supposed to do. You'll lose consciousness, and while you're asleep, your brain will clean itself, consolidate memories, repair damage. You'll wake up and your brain will function. Fatal familial insomnia patients lose that ability forever, and they die awake, watching their minds disintegrate, unable to escape into sleep. Fatal insomnia is a neurodegenerative prion disease that results in trouble sleeping as its hallmark symptom. That's the medical definition, the human reality. A disease that steals your ability to sleep, to rest, to escape consciousness, until your brain literally destroys itself and you die. There's no cure, no treatment, just awareness, support for affected families, and research that might, someday, prevent this nightmare. Sleep well, because for some people, sleep is impossible. And without it, life becomes a waking nightmare that ends only in death. IR experience.